and all the HODs that are present here today. Actually, it has taken a lot of time for this meeting. More or less, more than a month has passed, and we thought we should be going ahead on a fast track. Health is something which I always hold. Health is something that I always have a passion for. That's why I always hold on to that portfolio of health. And also I saw that there's a lot of work that is pending from the last term. There's a lot of small issues. All of you worked extremely hard during the period of COVID. All of us managed, and with your support, I think we were able to do a lot of justice to the people of the state of Goa. Most importantly, I wanted this meeting today, Dr. Guru Prasad, I was just checking, I wanted to start with cardiology. We spoke also, is that we need to have a review of every department. And though you may not speak out on an open platform, but there are several issues which are there in every department. And we have to see how we can address these issues. And you can be assured, and so I told the Dean that we'll have Dr. Bandekar, that we will have this meeting today. And our approach in these 5 years is going to be to provide the best of healthcare and have an integrated system with the health services also. I'm not saying that everywhere there will be engagement between the GMC and the health services, but in certain places we need to see how we can create, like what Dr. Bandekar said, is the hub and spoke model. Finances, all these things are there, is like a routine kind of a situation in every government. And all of us have seen how, in spite of all that, there are several verticals under which we can get different funding from the government of India. I have actually who's in the Niti Aayog to go with few specialists from here, and the Dean and our Secretary Health and Chief Secretary, and go and have and speak to them and understand what's the thinking of the central government, and what is the way we can get more funds into the system. The same, the TB hospital and that whole, your department here within the vicinity of Goa Medical College. But today we need to fast track every department that we have. We need to see how best we can, support you, whether it is Dr. Ponraj, whether it is Dr. Teresa, who always have been promising in the last 5 years, unfortunately because of COVID, several other issues. Today I don't think, in spite of some people, I don't know from where, I don't know if the doctors feel suddenly somebody makes a statement that suddenly in June there's going to be a fourth wave. So I don't understand how this calculations and creating, fear mongering among the public, and as a result it affects the overall state as a whole. Today I have come in front of you again after a period of 5 years, after we had excellent a type of interaction with each other, tried to do a lot. There have been so many instances and so many things and situations that we have gone through as far as Goa Medical College is concerned. People of the state of Goa believe in this institution of Goa College. People of the state believe in all of you, and as a result of which there is tremendous amount of load on this institution. I want that in this term that we are able to go in a very meticulous manner, and there has to be a plan. There has to be a plan for every year. Okay, this year this is our objective, especially block, which served as one of the most very important place during COVID, where all these things, unfortunately COVID put us on the back foot, and not only our place, but it put all of us in such a situation that we to only look at people and serve in terms of how we need to move forward. We thought at one point of time, after the first wave, the second wave won't come, second wave came, third wave came, and it's not that. I also thought I was like immune to, I was not going to get COVID, and I ended up getting COVID during the peak of my elections. So there was no way in which I could campaign also, because I did not understand that I had got COVID first. And then now these new variants which keep on coming, then we have to deal with it. But same time, there's not going to be any suspension. I don't think that's the approach anybody is following anywhere. But there are some states which they're having these type of issues. But we need to see and assess. And I think more than a minister, I think the experts and the expert doctors and panelists, members of that expert committee can decide. And within Goa Medical College, our doctors can decide as to what is the modalities that needs to be followed. I only want to say to you today is that after taking over health, officially I always believe taking over health is after interacting with you. And after interacting with you, coming to the institution and seeing what has happened, because it's been a very tiring period over the last 2-3 months. And I want to assure each and every one of you, like I had said earlier, starting with the cardiology department, starting with whether it is Dr. Anupama Borkar's department, whether it is getting more interventionists as far as ICUs are concerned. It is important that we have the best of facilities, and also I have put a suggestion to the government that the government at our level, every time we have to rush to the cabinet and we have to wait for every contractual appointment to take place. But then when you are running an institution like a health institution or you are running a hospital, there are certain specialists who are there who are ready to join the institution. Then we need some sort of wire mechanism to see that we are able to engage their services on certain parameters that are already laid down by the government. So hence we have to see how best we can, and I can this time Teresa has actually given up, I think, on the government. So basically I can only assure you that don't give up. We will see that your department is given priority. After cardiology, we will sit with your department to see that whatever you need and whatever I have been constantly assuring you that we will take it up on priority. Health is always going to be my priority subject. Health is always a subject which needs to be looked at very closely by interaction with all of you and all the heads of department. All of us understand, and I think for me this is my third stint now as a health minister, and in this stint I think I need to work more closely with all the HODs and understand where and what we need to do. We for now have tied up with HLL also, and I'm waiting for them. I don't know why they have not come to create a hub and spoke model. There will be all facilities such as radiology and several other things, because we don't find in the rural areas, we don't find people come for radiologists and all these about technical people in all the PHCs, CHCs. So basically to create a hub and spoke model and to see how to move forward. So we are working with PSU, and I hope this is successful and we are able to take this forward. Even the district hospitals will make it, like you had, I think once when we had spoken, we had said that you require CT scan and other facilities in the, if you want to thrombolize a patient in the periphery, then you require all these facilities in the periphery. So we need to see, just like how we have been doing through Dr. Guru Prasad and others, we have started the STEMI program. Similarly, we need to deal with patients suffering from stroke and other things, because several things are there in the pipeline. Tertiary Cancer Center, I think now that AFC has been given, it is coming to the cabinet. Cabinet was scheduled for 20th, it has been rescheduled, being rescheduled I think sometime next week. But our whole objective will be to see that we have state-of-art facilities. I also want to make an appeal to all the doctors is that we ask for suggestions. I think you should give us very clear-cut views and something that is workable and also something that is useful to the people in the city. Not because somebody says put something or do something, you go and do it. As doctors, as the main guardians of these institutions, I believe that it is you who have to look after this institution, and it is you who have to guide the government. I, for one, as an administrator, as from the administration point of view, my job is to see that I fast track everything that you suggest to whatever best possible ability that I am able to push it and see that I get approval of the Chief Minister and the Cabinet in the interest of the public. But definitely, this is going to be our main, this is definitely our, all of us don't need to know, but May being the only main tertiary institute in the state, there are several mechanisms and models we'll have to work around. Several new things and ways forward in terms of taking medical care to the doorstep of the people is being the vision of the Prime Minister, and that's the way we need to move forward. All of you have supported us. All of you have been very active, proactive, whether it has been enough infrastructure. And I think we have already discussed, I think we have not sat down for a meeting, but we'll have a meeting again. And also, I don't know how many facilities have shifted to the new super specialty hospital. So basically, we need to start moving into that. Gaps that are there, but we need to see that we fill these gaps. But in addition, we need to see that you start occupying that hospital with immediate effect, because we have already asked for denotification of that hospital as a COVID hospital, and we cannot live in this thing of COVID all the time, because that hospital has to be utilized for the benefit of the people that we are looking at. And I think that is what, that gaps which are there between what is now and what we need to achieve. And I think you need to bring out a plan department wise, because as we sit with every department, I think every HOD has to give us a plan. Let us take that plan in in a phase 1 and phase 2, so that we are able to get approval of the government also. And it's not a overburdening on the state government, and in that way we have to move forward. Because if every department gives a phase plan, then we are able to implement phase 1 of all the department and see that we are able to take things forward. It is important that I have been seeing many times people come to me, and a lot of people, we require this tertiary cancer institute because we find a lot of people going to Bombay. I for one believe that we should tie up with institutions like Tata Memorial or some other institution that can actually give us good service in the state of Goa, and not rather tie up with anybody and anyone, and it has to be something really reputed so that the people also have faith that they will go and take treatment there. Like just now doctor mentioned is that you require orthopedic 24/7 emergency OTs and all are required. We all see that there are a number of accidents are going on increasing. You find people, this accident rate is not coming down, and as a result of which whatever infrastructure is required, we will try to provide it. But I am not today giving a sort of a blanket assurance that 100% everything will be achieved. But definitely we are going to make a beginning to see what best we need to do to take Goa Medical College forward. For one, and for the thoughts that I've been thinking of, and that's why I said let's have a HOD meeting, because there are several other departments which have been given to me which I need to put on track. And as a result of which I thought my main portfolio, because whenever somebody asks you how important are all the portfolios, for me health is the most, as far as priority wise for me, in terms of delivery, in terms of achieving what we want to achieve. I would like to request Dr. Guru Prasad and his whole team, Dr. Amar is there, Dr. Pankaj is there, and several other doctors who are here. Department wise we'll be sitting down with you. And when we sit department wise, I think today we are on the 21st. And I would like you to somehow get a plan in place by the 1st of May. So that's enough time, because you're working in a system, you're already working there, you know exactly what are the gaps and what the government needs to do to fill up those gaps. Hence appealing to each one of you to give us a plan by the 1st of May, and then maybe on the 2nd or 3rd of May we will sit down in the secretariat, or maybe in one of the places, or in your conference hall here. I'll get the secretary, I'll get the chief secretary, so that we will see that we are able to understand. And what I want to do initially is go department wise, so that every department's issues I'm able to understand with total clarity. Then you don't require a second meeting after that. And then we put that in file and take it forward. But the HOD has to sign it off and give us a plan, and this plan should be ready by the 1st of May. And I will request the team to issue a letter to all the doctor HODs to please get us a plan in way forward. And if we implement A, B, C, then what is its outcome, what is the objective, why these suggestions. With thorough justification, we would require all these plans so that we are able to, in a very meticulous manner, move forward. Requesting all of you, and I am once again very happy that I have been given this health portfolio, and it gives me another 5 years to work with you and take things forward and working for the interest of the people of the state of Goa in a very different, in a very streamlined fashion, and in a fashion where, like I said, to some extent, there has to be integration of DHS and Goa Medical College. That's why I have told them is that from your point of view also, whatever your issues are, doctor, regarding these buses and other things, I'll definitely talk to the Chief Minister tomorrow and take this forward, because these are things that are necessities. These are not something these are any kind of a luxury item. I mean, students need mobility. All these things we will address, one by one we will address, and we will see that we put it on fast track and get it cleared from the finance department. That's why I said we'll get the chief secretary, who's also finance secretary, so that he is able to understand what the problems the doctors are facing, and let's move forward. And I would like to once again request you, and I think Dr. Guru Prasad, last meeting was with cardiac before the code of conduct came, as that we were talking about procurement of having another unit in the South Goa District Hospital. South Goa District Hospital is something which is very important, and we want that there should be an integration of some sort of an integration between activities between GMC and at least 1 or 2 units in the South Goa District Hospital. Otherwise, that hospital will not be able to function. That's a huge building, and we need to see how this Unit 2 can be created, or Unit 3 can be created there under your guidance, so that we are able to move forward. And similarly, I hope the HLL, and I'm confident HLL will give us what we are looking for. So appealing to all of you and requesting all the doctors and HODs, I'll also send you a personal email by today evening or maybe tomorrow morning, asking for a comprehensive plan. And it should be just a 3-4 page, 5 page max to max, with thorough justification. And it should be split up. If it is very vast, then maybe split it up into 3 phases. But we must have And 1 year and 2 years, in these 2 years, we should be able to put GMC where it has to be, and whatever we can do, we need to do and take it forward. Whatever the gaps are there, whatever amendments need to be looked at, we will look at these amendments. Whatever contractual doctors you require, whether in the cardiac setup or whether in the cancer setup or whether in any other setup, whether it is in in your neurology department you require, because strokes are going up. And also I want to suggest one thing to you is that whether in the Goa Medical College, if we are able to start these executive checkups also, to some extent. I don't know how this is not for having an executive kind of a premium checkup what is being done by private hospitals. My whole thrust is, I'm just using this terminology, but I'm just talking about a preventive kind of thing. So the thrust of us, Goa Medical College, all of you senior doctors who are sitting here, it is very important for us to also put a lot of pressure on this preventive medicine part of it. Many times none of us understand what is going on with our bodies. Many times you end up getting some sugar and suddenly one fine day you end up getting some other complication. Why wait for those complications? So I think there has to be some integration, even sessions with the doctors and senior, give a sort of a orientation to the DHS. DHS also, the new doctors come, they can come and spend some time in Goa Medical College and then they can go out. Reason I'm telling you is that none of us, we have got several facilities that we need to do in Goa Medical College. Whether basic endoscopy, whether it is colonoscopy somewhere, nobody even understands. If you tell a common man that this is a polyp, he will not even understand what that polyp is. A polyp can be different types. All of you know what I'm talking about. Today, the type of cancers that people are facing, you find that there are different types of polyps which don't matter. This is something that we need to put our thrust on, and all the doctors need to give suggestions. So when you're giving suggestions pertaining to your department, what is the role of that department? What can that department do in terms of even preventive medicine? That is something which I think you need to put a thrust on. Actually, this was my main agenda today, to come and talk to you about all these things, because several times a simple guy, a person like me also, stress can create any kind of thing. Suddenly you develop pressure, suddenly you develop sugar, suddenly you find something else happening. You don't know what happens to a human body. As a result of which, whether it is cardiology, I think some talk, some kind of thing, some sort of active social media presence of Goa Medical College is very important. And your talk to the society is very important. Tomorrow, if you do something which is very complicated in your department, doctor, I think you have to inform us and tell us, okay, these are the things that you have done. We'll put a team together under the Dean's office so that this information is given to us. A lot of people don't know what are the activities of the Goa Medical College and to what extent you are working and trying to save the lives of the people in this institution. Many times, it's the private sector that hogs the limelight and goes away. And as a result of which, people don't understand that Goa Medical College is an institution which is really working for the welfare of the people. Reason I gave you an example of polyps is only one aspect. There are multiple aspects. Common man doesn't understand. Common man doesn't even go for his blood test every quarter or every 6 months, even if he's on medication, unless he's told by the doctor that you need to do your blood test, you need to have these parameters checked. Hence, we need to have a normal common protocol. The e-card also we are trying to see so that you are able to access the information of the patient. If he is a patient from the health services, then if you integrate it, for that HMIS is required. HMIS only in the super specialty is not going to help us. HMIS has to be there even in the Goa Medical College. And as a result of which, I have been moving for this HMIS. HMIS is not, like I always use this terminology, is not some luxury item. It is something that is a need of the hour. And like you mentioned, like you go to any top hospital abroad, you get all your reports online. By the time you finish your test, patient come for consultation, your reports are already ready and available on the system of the doctor. So this is something that we need to achieve, and we will do it. But what I am trying to tell you, and Dr. Teresa will agree with me, is many times, people don't know. That's why somebody like you giving a talk, or somebody, I'm talking from your social media point of view, what you're doing, what if you're dealing with some cases. Today, young people end up getting strokes. Young people end up lying in the house, paralyzed in the villages, and you don't even know, they become a liability on society. As a result of which, preventive medicine is some area, a major area which we need to look at, and we need to have additional facilities for what needs to be done, because if you look at it, if you look at your basic cancers that are increasing, earlier it used to be breast cancer. People used to very rarely earlier speak of colon cancer and other related cancer or liver cancer, but today this is all galloping at a different pace. And as a result of which, it is very important for all of you to make suggestions to us. I am not saying make suggestions from your institution point of view. make suggestions in such a manner that you are able to give input to the government, that we are able to implement it in the DHS in and other peripheries by creating that type of awareness to the people. And it is very important. This is very important and very like if you put a person on statin or you put a person, then what's the impact of that tablet on his liver after a particular period? All these small things. Common man is not bothered. Common man comes at a stage after even if he does your angioplasty or everything, after sometimes he becomes carefree and then he doesn't know what is happening. So, we need to go in a different, I'm not saying it happens here in GMC, but I'm just trying to understand the mechanism and how to move forward, for which I think all of you need to give us the inputs. We are here to see that we do something positively for the people of the state of Goa in terms of preventive healthcare. And preventive healthcare means I want the help of the doctors from Goa Medical College. If we have to prevent people from getting strokes and other things, then what is the checks and balances that we need to follow? All these basic protocols, we need to make them and highlight them to the common man and to the people, to the people in general. It's not just sufficient by just giving you a health insurance card or something like that. We don't want you to use that health insurance card. We want you to be healthy. We are giving you a security. But at the same time, then this program in where we are able to create sufficient awareness. Today, Women and Child Department is under me. Today, DHS is also with us. Today, GMC is also with us. So for that, all the HODs should give us some sort of a concrete plan as to when you give this plan. And I'm requesting all of you, first is a cutoff. Second, third or fourth, I will sit with you department-wise, and within the month of May, we'll finish all the departments with the Chief Secretary and Secretary Health and Dean, so that we are able to move forward in a particular way. But my appeal to all of you is please give us a solution to healthcare situation, and healthcare solutions in the state will only come if we are able to have a thorough approach on what do we want to do and how we want to take this future generation and keep them safe, and how we want to take this 5 years forward. So I appeal to each one of you, and especially Dr. Teresa, you got a very big role. You got a lot of load, but no people to help you. So basically, I have understood the situation. Today also I was thinking before coming is that every time I promised you something I couldn't deliver. But then this time we are going to push what we want, and what are the areas that we need to push. If there is a small team of doctors that is made within the GMC, then we will be in a better position to implement it. Because if I just say that everything will be implemented, it will not be possible. Then what are the few things that we can implement, and what are the few things that we can do? What are the few things, like a lot of your new studies which have come forward as far as the strokes are concerned, and thrombolizing a patient beyond the golden period, whether that can be done in the South Goa District Hospital, whether it can be done in Ponda, whether it can be done in Mapsa. These suggestions and solutions should come from you and Dr. Ponraj, both of you. And basically my appeal to you is to give us these suggestions and with justification. Even when you want staff, put some basic justification so that for us to understand what is happening, with the load that is there with you, and what is the trend that you are moving towards. How many cases, what has happened in the last 5 years, what was the impact of COVID, after COVID, whether the cases have increased, reduced, what is going on. Actually, if you give us a small little gist so that we are able to understand healthcare in a much better way before we take any kind of policy decision, I would like to appeal to you that this is something that we need to look at and take healthcare forward in the state of Goa. And I would like to thank all of you once again, because you did a phenomenal job during COVID, whether it is over, not over, that is only time. But thanking all of you for having served the people of the state of Goa and giving me, once again, I got an opportunity to come and be with you